Hi kids and parents, my name is Beth Bennett and I'm one of the recreational therapists here at the Shriners Hospital for Children. First off, I'd like to tell you what recreational therapy is. It is using recreational services and leisure experiences to help people with limitations make the most of their lives, mentally, physically, and socially. It involves therapy, which will improve functional abilities to help increase independence, leisure education to teach you new leisure skills, and participation to promote growth and health through positive leisure experiences. Now you're probably wondering why all this is so important, because it'll help us all get well, live well, and stay well. We are located in the Central Activities area, and I look forward to recreating and playing with you.
Hey, my name is Kristen.
And I'm Courtney.
And we're both recreation therapists at Shriners Hospital for Children. We're here to talk to you about activities we provide for you during your stay. On Monday through Thursday, we are open from 10 a.m. to 8 p.m. From 10 to 11:30, it is free time for you to decide which activities you would like to participate in. We have things such as air hockey, pool, basketball, video games. You could draw, read a book, do a puzzle, and then we close for lunch from 11:30 to 12:30. From 12:30 to 4, we have structured activities, and this includes Home Depot coming, arts and crafts, cooking groups, and physical activities. We close for dinner at 4 and reopen at 6. Our evening hours are free time as well. This is a good chance for you to meet other kids in the hospital and participate in activities that they like to do and you as well.
On Friday, we are open from 10 to 4, closing at 11:30 for lunch and 4 for dinner. From 10 to 11:30, we have free time, and from 12:30 to 4, we have structured activities. At 6 o'clock, we have teen movie night for those patients that are 12 and up. If you're not 12 and up, you should find one of the recreation therapists so that we may find you something to do in your room that night. On Saturday and Sunday, we are open from 10:30 to 7, closing at 11:30 for lunch and 4 for dinner. These 2 days consist of free time where you may choose to do whatever that you would like. We also have groups that come and visit us here at the hospital. These groups provide games and activities that you may do while you're here at the hospital.
For all our long-term patients, we also provide opportunities for you to go out into the community. These are called our outings. They can vary from fishing trips, sporting events, and movies, going to the mall, going out to eat, and these are things that you can discuss with your rec therapist.
Hi, I'm Frasianne. I'm a recreational therapist here at Shriners Hospital. And I'm going to be talking about the pre-op medical play sessions and the TV carts. Going to the hospital can be a very scary time for our patients and their families. So we have developed a program for patients ages 4 to 11 that they can come to a pre-op medical play session and tour. The pre-op medical play session is done in conjunction with nursing. A nurse is available to come into the pre-op medical play room and answer any questions that the patient and our family may have about the upcoming surgery. This session is done so that it can help reduce any fear or anxiety that the patient or family may have about the upcoming surgery. During this session, the patient can actually become a doctor and follow in the doctor's role, and the actual role of patient becomes a small stuffed doll. Our patient is shown the different types of equipment that he or she may see the day before or the day of surgery, and they can actually put their hands on and feel and know the different types of equipment that they will be using or on them or that they will have. After the medical play session is completed, there is a tour of pre-op holding and recovery room, and then there is a tour of the waiting room in which where the doctor will come and talk to the parents after the surgery is completed. The TV carts are placed in the room with the child that's having surgery. So if the patient's having surgery, they will get a TV cart. On the TV cart, there's a television, a game system, and a DVD or VHS so that they can watch movies or play games. The games are on the side of the cart in small pouches. This is to help reduce any anxiety or fears that the child may have of the upcoming surgery and trying to get them into a routine that they may have at home. These TV carts will be kept in their rooms until the child is able to get out of their room and start participating in some of the recreational therapy events that are going on during that week or that day that they're there.
Hi, my name is John Arnold. I'm the Director of Nutrition Services here at the hospital, and we just want to introduce ourselves and welcome you to the hospital and tell you that these people here are the people who are preparing your food each day. Thomas and Clark take care of all the breakfast for the patients and in the cafeteria, and Susan takes care of all the lunch and dinner for the patients in the cafeteria. We do have a dietitian on staff, and we really would love it if you would contact through nursing our dietitian if you have any special diet requests or needs or special things that you know that your child will or won't eat it. If you let us know, then we'll try to prepare meals around that to make sure that your child gets food that they like as well as healthy food to help them in their healing process. We do know and understand that nutrition is very important to the health and well-being of our children and your children and our patients. And part of what we do is try to make food that looks good and tastes good but is also healthy for the child. So any help that you can give us and suggestions on that, we greatly appreciate it. Our service hours in the cafeteria, we serve breakfast 7:30 to 9, 7 days a week. In lunch is 11:30 to 1:30, and dinner is from 4:30 until 5:45. There's a little bit of difference on the weekend as far as where you get your meals from. 7 days a week, your breakfast trays are prepared and delivered to your room. For lunch and dinner, lunch during the week, you'll pick up your meals in the central activities area where we try to get all the kids together to where you can have a little bit of social time and get out of the rooms. But if your child is unable to come down to the central activity area, the nursing staff will deliver the meal to the room for your child. Then for dinner, the children or the nursing staff can come through the cafeteria line and get their meals, and nursing staff will bring it to the room again if the child is not able to come down and get their meal. On the weekends, all 3 meal services, breakfast, lunch, and dinner, are prepared and served from here in the cafeteria. You can come and pick up your meal with the patients, or if the patient is unable to, the nursing staff will pick it up and bring it back up for you. So we're excited to have the opportunity to help with the nutrition part of the well-being of your child, and anything that we can do. If you see any of the 4 of us out in the hospital, in the hallways, in the central activities area, or wherever it may be, stop us and let us know how we're doing. Give us any suggestions that you might have, and we definitely want to try to take best care of we can for your children.